Hi, my name is Angie Hwang. I'm a third-year medical student at Mayo Clinic Elliott School of Medicine in Arizona, and I'll be presenting on our research titled Oral Montelukast as Treatment Option for Aphthous Ulcers. To start off with a brief introduction, aphthous ulcers are the most prevalent oral mucosal lesions in the general population, and yet treatment remains a challenge. Currently, topical steroids, antiseptics, and analgesics are the typical first-line management options, and systemic medications such as steroids are used if these first-line options are ineffective. There is evidence that oral Montelukast or Singulair is efficacious in treating aphthous ulcers. A randomized placebo-controlled trial comparing Montelukast against prednisone therapy for recurrent aphthous stomatitis demonstrated Montelukast has superior efficacy compared with placebo, decreased efficacy compared with prednisone, but decreased adverse effects compared to prednisone. So we sought to evaluate whether oral Montelukast reduces number and frequency of aphthous ulcers. We conducted a single-center retrospective study and identified subjects with a minimum of 2 distinct encounters using the search terms Singulair or Montelukast and aphthous ulcers. We had a total of 16 subjects meeting this inclusion criteria and who were found to have follow-up after treatment. Going over our results, over half, specifically 56.3% of patients had a positive clinical response, which was measured by provider assessment. And among these, 44.4% had reduction in number of ulcers, 22.2% had decrease in frequency of ulcer eruptions, and the remainder had unspecified improvement. In our study, the mean dosing was 9 milligrams daily with a range of 4 to 10 milligrams. 4 to 5 milligrams was prescribed to pediatric patients and 10 milligrams for all other patients aged 15 and older. While 10% of patients in the aforementioned randomized control trial reported side effect of diarrhea from Montelukast, none in our study reported any side effects despite a mean therapy duration of 455.4 days. And this therapy duration was measured by encounter dates in our study. And in addition, the RCT had an active treatment duration of 2 months. And our study demonstrates a longer lasting efficacy of Montelukast as response was measured at the last related encounter. So to summarize, our study further strengthens support for Montelukast as a safe and effective treatment option for recalcitrant aphthous ulcers with reduction in both number and frequency of ulcers. Montelukast has minimal adverse effects, even with long treatment duration, compared with other systemic medications that are commonly used for management of aphthous ulcers, while still demonstrating effectiveness. And additional studies are required to determine the recurrence rate after cessation of Montelukast, and we recommend larger trials comparing Montelukast to first-line medications such as topical steroids.